This is an ultrasound study of a young female referred to rule out any cause of PUO with no lab profile or any other imaging modality or clinical notes provided. What's seen is here in this view that the kidney is okay and that the gallbladder is okay. Portal vein is normal. This is the gallbladder, this is the portal vein, and when I move the probe towards transversely below the costal margin, I come across an echogenic area, relatively hypoechoic. You see, this is the liver, and this is a relatively hypoechoic area with irregular outer surface and internal cystic area with echoes in it and a few tiny calcifications. This is the diaphragm, right heavy diaphragm, and this is the posterior segment of the right lobe of the liver. Now this focal lesion is this is called liver, and you see that the echogenicity of this area is relatively less as compared to the adjacent parenchyma. I can also report that there is a cystic area surrounded by a thick rim of hypoechoic area around it, and the cystic area is full of it, low level, very low level echoes. And here we are again. Now this is in fact, there is now, let's study this area in bit detail. See, there is no posterior strong back wall is not seen, not due to maybe two factors. One, there is a diaphragm here, but even then, even if this is a hemidiaphragm, right hemidiaphragm seen, had this been a cystic area or a totally cystic area filled with echoes, we would have seen a strong back wall or increased acoustic enhancement. Now, as we are seeing a clear black posterior wall. No acoustic enhancement does not mean that this is a solid mass. The reason is why we do not see the posterior wall acoustic enhancement or strong back wall is that the through transmission from this focal area, the through transmission of the waves is being degraded or retarded by this hypoechoic band of tissue that is seen surrounding this central hypoechoic area, rather anechoic area, and because of this thick band of hypoechoic area, when the waves, when they travel this area, they are absorbed to the extent that by the time they reach the posterior wall, they are attenuated so much that they do not give you a posterior strong back wall. So this is not a solid area. Relatively, yes, you can say, but this is in fact a cystic area being surrounded by a hypoechoic thick, you see, this is approximately 20 mm thick rim of hypoechoic area seen in the posterior segment of the right lobe, just adjacent to the right hemidiaphragm. And this is the cause of PUO in this patient. There is no other satellite lesion seen, and this finding is consistent with a healing phase liver abscess. This is a liver abscess in fact, and the central area is relatively is a fluid filled with echoes in it, and if we see it in a bit detail, we will see that there are a few tiny calcifications also seen in it. Now you see these these are tiny echogenic particles consistent with internal tiny internal calcifications. Here you see this is the one which is giving posterior shadow, and so what we are seeing is in fact a healing phase liver abscess in the posterior segment of the right toe. Thank you very much.